One of the big trends in dental care is to make the patient's visit as convenient and comfortable as possible. One office that has been a leader in that effort is Oak Creek Dental. Their approach is always to make a patient feel at ease when they sit down in that dentist chair and leave feeling that they had the best possible care. But for some, it's just hard to get over that fear. So Oak Creek has a solution. Just sleep through it all. I love that. Dr. Timothy McDuffie is here now to explain. He also brought along a patient, Carol Hines. Welcome to both of you.
Thank you, Dave. It's great
Tim,
to be here.
You know, when you think about sedation like this, you think about a surgical procedure. You're going to the hospital or something. How long has this been a part of dental procedures, and how long have you guys been using it at your office?
IV sedation's been around as long as dentistry has. For oral surgeons, use it all the time for third molar extractions, and a lot of dentistry is surgical. But aside from that, patients don't need to be embarrassed. Sometimes they have a high anxiety that keeps them from going to the dentist. Sometimes that fear that keeps them from going for years and years at a time until they get toothaches. There's also people that gag very badly. We put an x-ray in their mouth and they gag. People are difficult to numb. People have long appointments. They have a lot of work to catch up on, or they have other time constraints with their work where they can't be coming in all the time. So IV sedation, we found at Oak Creek Dental Care, myself, Dr. John Signini, and Dr. Rob Bang, we all provide IV sedation for our patients so that they can take care of their dental cares all at once or in shorter visits, longer visits, and get more done at one time.
A little more efficient.
And some patients have one of these problems. Some people have several of them. Carol has been through this several times, and she can tell you she's had several of these issues at once compiled together, and she's just been marvelous to work with. You'd never know that she needed IV sedation or that she required it or that she requested it, but it's worked out very well for her.
Well, Carol, let's talk about your particular situation and why this was such a good solution for you.
I have a lot of reasons. I numb very difficult. I've had one dentist give me, I think, 4 injections and never numbed an hour. So I knew that when I came to Oak Creek, I had to figure out a way to have the work I needed done that I've been avoiding because I didn't want the needle numbing me and not working. And then I also have some underlying medical conditions that cause me to twitch up in front and in my face. And the last thing I want is a drill in my mouth and me twitching, and just didn't sound very pleasant to me.
Right, so this is a perfect solution for you then.
Oh, it's wonderful. I love it. I mean, how many times can you say in your life that you took a nap and you woke up accomplishing a lot?
That's good. How deep is the sedation, Tim? When you're out, I guess, right?
When we do IV sedation in the office, most of the time people do what's called moderate sedation. It's very safe. We monitor everybody, but they're never beyond a point where we can't shake them on the shoulder and say, hey, tap for me. Or take a deep breath because we're watching and maybe their breath is getting shallower. We've also got options where if people want to go even deeper than that, we have an anesthesiologist come in and do it. But most of the time it's what we call moderate sedation.
And does that allow patients to drive themselves home, for example, after the appointment, or how does that work?
No, with IV sedation, patients will have somebody come with them, and we tell them, because the medications, although they will walk out on their own power, they will forget a lot of what happens on there. They will have very little memory of it. It's just best that they don't drive or do anything where it really requires good thinking for about 24 hours.
Carol, do you remember any of it? Do you remember any of the sensation? Well, how much of it do you recall, or do you feel anything? Well, you were there.
The only parts I remember are waking up to do the bite. They get everything done. You wake up, you do the bite, you go home, take a nap. That's all I remember. And my family, when I wake up, tells me, oh, look at your teeth, they're so beautiful. I'm like, I don't remember a thing.
But that's what
Thank you, I love them.
That's exactly what you want.
Exactly.
Tim, what types of procedures are best for the sedation? I mean, what are you looking for there?
Well, like we talked about, because there are so many different reasons people may want to use IV sedation, we've used IV sedation for as little as having people come in and get their x-rays and find out what they need and do a cleaning. Other people, we're taking out a lot of teeth or doing root canals, crown and bridge. It runs the gamut.
Well, so
people have a lot of different needs.
It's a good solution for whatever, really, seriously, from the relatively minor to something more serious.
It's patient-driven. We don't tell them, no, you can't have that if it's a simple procedure. If in their mind it's just too much for them, then it's great for them.
Perfect.
And it works. I tell you what, we can do better dentistry when people are very relaxed.
And that's the message.
Yeah,
Tim,
absolutely.
that's great. Your phone number is up there if people need to get a hold of you. Appreciate, Carol, you being here. And Tim, good to see you again also.
And if I could, just if people would go to our website at www.oakcreekdental.com, we do have a $79 special where they can do an exam, an x-rays, cleaning, and get fluoride.
Perfect. Thank you very much, both of you, for being here. Good information.